Welcome to Learning Plan 10, which is Issues in Theory, Practice, and Research. So this is where we're going to talk about contracts, assessments, the DSM-5, evidence-based practice. So I have a couple examples of contracts in this learning plan as attachments for you to review. And contracts are something that we use quite often in counseling and social work, in the helping profession. And when I first got into the field, I thought contracts were ridiculous and there was no reason to use them and that they really didn't work. And I found that I was very wrong, and contracts actually do work and they are very helpful. So with contracts, you're really holding someone accountable and you're giving a specific task or a specific behavior that needs to change, and you're actually putting a due date on that. And you're putting it to writing and you're asking them to sign it, and you're asking also for you to sign it, usually a supervisor, a director, the MD, and then you're giving them a copy of that, and it really holds them accountable, and it's something that I would always put at the front of the chart. And so when I opened up the chart, I would be kind of like going over the contract and where their progress was at, and really holding clients accountable. So contracts are something that when you get into the field, do not be afraid to use them, and they are actually very effective. Assessments, I briefly talked about assessments a little bit. Assessments really do take a long time and can be kind of boring at times, and some clients are just like, I just want to get down to what I need, and this is a waste of my time. And trying to help your clients understand that it's really, really important to get a very thorough and good assessment, because we can't really get to the bottom of things until we know exactly all of the issues, all of the dynamics, all of the things that are actually involved in why they're really at your doorstep. DSM-5, the Diagnostic Statistical Manual, things have really changed from the 4 to the 5, and you're going to really go through this a lot more in like assessment, diagnosis, and treatment class, and a few other classes, and more your 3rd and 4th semesters. So this just touches briefly on that. Evidence-based practice is really what type of techniques really show that they work. Motivational interviewing, cognitive behavioral therapy, those are evidence-based practice. And those are things that are techniques that insurance companies want to know we're using, and actually in the forms that we fill out for insurance companies, some of them will not pay unless you are listing an evidence-based practice technique that you're using in your therapy, in your counseling, and whatever type of modality of treatment that you're using. So something that you need to really be aware of.